If your agency is overwhelmed with paperwork, slow follow-ups, missed calls, or constant administrative delays, it's not because you're understaffed, it's because you're not leveraging remote medical assistance. Top-performing home care and home health agencies are now using remote medical assistance to streamline operations, reduce costs, and improve care coordination. Today, I'm going to show you exactly what remote medical assistance can do for your agency, and why they're becoming a must-have in 2025. Stay until the end, because the last function I reveal is the one agencies overlook the most, and it saves the biggest amount of time and money. I help home care and home health agencies build efficient, profitable systems using a combination of in-house staff, remote workers, and automated workflows. Remote medical assistants have transformed how agencies manage scheduling, documentation, communication, and compliance. Today, I'll walk you through the specific roles they can perform and how they can immediately improve your operations. Agencies struggle because office staff are overwhelmed with tasks like intake calls, scheduling updates, physician order requests, documentation follow-ups, insurance verifications, prior authorizations, caregiver onboarding, compliance management. When these tasks pile up, the entire agency slows down. Remote medical assistants solve this, but only if you understand how to use them properly. By the end of this video, you'll know what remote medical assistants actually do, how they support your clinical and administrative workflows, how agencies are using them to reduce workload and increase efficiency, real-world examples, successful implementation, the areas a remote staff outperform, and how staff let's get into the roles. Handle intake and triage calls. Remote medical assistants can answer calls, gather client details, and triage inquiries before passing them to the appropriate team member. A home care agency missed 12 inquiries in 1 month because office staff were juggling schedules. A remote medical assistant took over intake calls, conversion rates doubled. Quick tip: if you're missing calls, you're losing clients. Support scheduling and visit coordination. Remote in ways can assist schedulers by monitoring caregiver availability, confirming shifts, and communicating updates. A scheduler spent for hours a day managing calls and texts. A remote MA stepped in to handle communication, cutting that time in half. Quick tip: use remote staff for communication, using house staff for decision-making. Manage documentation and chart completion. They can request missing notes, review charts for completeness, and alert staff when documentation is incomplete. A home health agency had delays because nurses submitted incomplete documentation. The remote MA followed up in real time. Submission times dropped from 4 days to 24 hours. Quick tip: a remote MA can prevent denials before they happen. Handle physician communication and orders. Remote MAs can fax orders, request signatures, follow up with physician offices, and track pending documentation. A physician's office misplaced an order request. The remote medical assistant followed up daily until it was signed, avoiding a PCR denial. Quick tip: consistency is key, and remote staff excel at it. Assist with authorizations, verifications, and insurance coordination. They can manage prior authorizations, eligibility verification, authorization, renewals, payer documentation requirements. Scenario: an agency missed an authorization expiration and delivered unauthorized care. The remote may install a tracking system. No further losses. Quick tip: remote staff are ideal for repetitive but critical tracking tasks. Support caregiver recruitment and onboarding. Remote medical assistants can process applications, schedule interviews, collect documents, conduct reference checks, prepare orientation packets. Scenario: an agency doubled its caregiver recruitment volume after assigning a remote MA to manage applications. Quick tip: your recruiters should be interviewing, not chasing paperwork. Perform quality assurance monitoring. Remote staff can track KP, ensure compliance tasks are completed on time. Common QA tasks include monitoring missed visits, tracking training completion, checking timely documentation, auditing caregiver files. A remote assistant caught missing TB test updates before surveyors found them. Quick tip: Remote staff are perfect for recurring compliance surveillance. Conduct follow-ups with clients and caregivers. Communication builds retention. Remote MAs can handle welcome calls, weekly satisfaction check-ins, post-incident follow-ups, survey call scenario. Client satisfaction scores increased when remote staff began handling check-ins consistently. Quick tip: consistency builds trust, something remote teams do exceptionally well. Case example: a growing home care agency hired to remote medical assistants. Within 60 days, they cut missed calls by 80%, reduced documentation delays, improved caregiver onboarding speed, eliminated authorization lapses, saved over $6,000 per month compared to hiring in-house staff. Remote medical assistants became the backbone of their operations. Summary: recap. Remote medical assistants can support your agency by handling intake and triage, scheduling communication, documentation tracking, physician orders, authorization and insurance tasks, recruitment and onboarding, quality assurance, client and caregiver follow-ups. When used correctly, remote staff transform your agency's efficiency, quality, and profitability. Comment remote and MA below to get the remote medical assistant task list that shows exactly how to integrate remote staff into your agency.